Do you or your loved ones snore? What causes this, and is there something we can do about this? Hi, I'm Dr. Lawrence Woods from the Spinery, and today we're going to investigate why we snore and things we can do about this. Researchers have found that chronic snoring stems from both an amalgamation of factors, both genetic and certainly hereditary conditions such as obstructive sleep apnea, and non-genetic such as lifestyle. And while snoring doesn't have any, let's say, straightforward official remedy, there's a large array of treatments and alterations to one's lifestyle that you can do to help stop snoring. Gender, in a binary sense, plays a significant part in determining how susceptible you are to snoring, as 40% of men snore in comparison to, let's say, 24% of women. And age is also related to snoring, but the latter decreases in frequency as the former advances, let's say, past the age of 70. Other factors include position while sleeping, for example, people who sleep on their backs. And this is due to the tongue being relaxed during sleep, sliding into the back of the pharynx, which obstructs respiration. It could be anatomical or physiological traits like narrowing of the lumen or airway passages, large adenoids, uvula, too much tissue in the back of the throat contribute vastly to the occurrence of snoring. Not getting enough sleep due to throat muscles becoming too relaxed during sleep. It could be nasal congestion, and anyone out there who's ever broken their nose knows about deviated septums, which can cause snoring. And the big one would be smoking and alcohol consumption, which also, again, relaxes the throat too much, just like sleep deprivation. There's also one other cause for obstructive sleep apnea, which means a temporary loss of breath while sleeping due to an obstruction in the airflow, usually at the level of the nose or throat. And it's usually caused when the tongue slips into the back of the pharynx again, or enlarged adenoids or tonsils. And symptoms include, let's say, gasping, choking, headaches, and not just normal headaches. Headaches that last a long time, especially in the morning, persistent drowsiness or tiredness, hypertension, nocturnal chest pains, and a sore throat upon waking up. And this disorder is mostly genetic, but it occurs in people who are overweight as well, and OSA requires some serious medical attention. And although it's not necessarily a lethal condition, it can be a signal for much bigger problems down the road, like cardiovascular disease or even cancer. There are many ways to reduce snoring, especially for those who do it a lot and very loud. And here are some of them. Usually the last resort is surgery, and this is where the doctors remove tissues that may be, according to them, in excess in the back of the throat. And the term for this is maxillomandibular advancement, or MMA. Sounds like fighting, doesn't it? But the translation here is that it pushes the jaw forward in order to improve the airway. Another medical treatment would be the use of oral appliances such as mouth guards to keep everything in your mouth in place. According to my patients, these are rather unpleasant due to the fact that they may cause dryness in the mouth or even pain in the jaw. Continuous positive air pressure, Cpap. I used to work in this field a lot back in the 80s, and this is rather expensive and possibly disturbing sonic factor on sleep. It entails the use of a machine or a pump that pumps air into the sleeper through breathing mask, and after the air has been pressurized and humidified. But all those three things are kind of passive treatments, and if you're the kind of person out there who objectively looks for things to do with your, let's say, own volition, experts feel you can try these things. Weight loss is a big one. Try intermittent fasting. And there's a lot of exaggerated claims about intermittent fasting right now, especially it's being trended in Hollywood. But personally, I've been doing it for decades, long before, I told you I'm from New Jersey, long before I even heard the term intermittent fasting. But saying this, there's all types of eating patterns, and they don't suit everyone. I get it, okay? I'm just saying that it worked for me. Long story short, according to the intermittent fasting regime, you focus on when you eat, not what you eat, and they say try to eat within a 4 to 6 hour window. But here's a simple, much more simple way of looking at it. Just skip breakfast. There's really no reason to eat breakfast, okay? And I'm probably gonna get a lot of hate mail for saying that, but just try it before you write to me, okay? Here's another one. Brush your teeth at the end of your last meal, so this way you won't snack at night. The next one, researchers feel by quitting smoking, and there's a strong correlation between smoking and snoring. Nasal strips, that's kind of trending right now, to expand the nasal breathing passages. Most chemists and drugstores sell these things. As I said earlier, avoiding alcohol and sedatives, especially late at night, which relax the throat too much. Sleeping on your side, especially the left, since the right side might lead to digestive and excretory system problems. Better bedding, softer mattresses may help encourage side sleeping, as it complies to the shape of the sleeper's body, which causes less strain, because your body's kind of on the knife edge, but it's less strain on the spine, the hips, the shoulders, while you find a good pillow that can reduce the snoring by keeping the sleeper's head in the right place rather than sliding back. In my pillow, the Dream Pillow, I've been working on this for years, And I think I got it. And lastly, sufficient rest. Around 8 hours is optimal. And I just did a video on this. I'm going to put the link below on how you can achieve this. I hope this helps. I'll talk to you real soon. Oh, and don't forget to like and subscribe. Thank you.